Welcome, everybody. I'm Andrea Wolf. Before we begin, I want to acknowledge the pain that this country is feeling right now. We stand with those suffering from the pandemic, those fighting racism, and those hurt by violence. We pray for more peaceful times soon. I'm Andrea Wolf, the CEO of the Brem Foundation to Defeat Breast Cancer, and I am so excited to be here today with you, Valerie Jarrett, and Rachel Brem. For those of you who joined us for the last two Empower Hour events, it's great to be with you again. And for those joining us for the first time today, I'm so glad to welcome you to the Brem Foundation family. Before I turn it over to our pioneering speakers, Dr. Rachel Brem and Valerie Jarrett, I want to tell you about the Brem Foundation and its response to the COVID-19 crisis. The Brem Foundation maximizes women's chances of finding early curable breast cancer through education, access for women in need, and physician training. Brem zealously focuses on the early detection of breast cancer because breast cancer is over 95% curable when caught in its earliest stages. Just last year, the Brem Foundation teamed up with Lyft, in large part because of Valerie's vision and leadership, to create the country's first cost-free transportation program dedicated to breast care. And we launched an award-winning video to bring breast health information to the masses. Now, though, we are streamlining our focus on breast care during and after COVID-19. Many women haven't gotten breast care in over 3 months, and many of those have lost their jobs and their health coverage. We are fighting so that they get the life-saving breast care they need and deserve. We are also teaching people how to convert bras to masks to help lower-income communities access protective gear during the pandemic. And that's where you come in. We need you now more than ever. Your support of the Brem COVID Emergency Initiative saves lives. A donation of just $29 pays for a ride so a woman can get to or from her breast appointment. A donation of $102 pays for a unilateral ultrasound. A $290 contribution pays for a diagnostic mammogram. And a $535 gift pays for a biopsy. During today's program, we will send out a link in the chat box. So we encourage you to donate and would be so grateful for your support. If we raise the $200,000 that we need, you will help save over 400 women in need. On behalf of the women we serve and the Brem Foundation, we are so grateful for your support and friendship. Just a few items to note before we start. We'll have a robust question and answer period after our discussion with Valerie. Throughout the program, we will send that link in the chat box. And please use that link to support the Brem Emergency Initiative. Please also share that link with others in your networks who might not be here today. Now, I'm thrilled to introduce Dr. Rachel Brem. Dr. Brem will talk to us about the state of breast care during COVID-19 and will share some personal insights from her own battle with COVID-19. Dr. Brem is the Director of Breast Imaging and Intervention at George Washington University. She's the Chief Medical Officer of the Brem Foundation. She's a zealot for early detection, a breast cancer survivor, a decorated physician scientist, and most importantly for me, my mom and the grandmother to my 4 daughters. Welcome, Dr. Brem, also known as Mom.
Andrea, thank you so much for that wonderful introduction. I must start by sharing that I stand in solidarity with everyone here today. Each and every one of us has been profoundly impacted by the injustices, racism, violence, and pandemic that plagues us. We look forward to a better world because in these unprecedented, indeed unfathomable times, we must all hope that the future will bring justice and health to all. With that, and in that spirit, I am delighted to be joining you at the 3rd of the Brem Foundation Empower Hour lecture series. I like to think of myself as having dedicated my life to research and novel approaches to improving the care and survival of women with breast cancer. I've spent my life dedicated to fostering novel technologies to improve the outcome of women with breast cancer, to optimizing the care of women with breast cancer, and to educating and empowering women to maximize their chances of finding an early curable breast cancer. Previously, I didn't focus on COVID-19, but the pandemic and my own personal experience with COVID-19 altered that. I was the second person diagnosed with COVID in Baltimore County, Maryland in early March. I developed many of the symptoms you know too well: an endless deep cough, shortness of breath, weeks of intermittent fevers, persistent abdominal pain, loss of taste and smell, and indescribable fatigue and muscle pain. But I'm extremely fortunate. I fully recovered at home, never being hospitalized. I'm now back at work focusing on breast cancer. Like everything in our lives, even this has changed. Not only do I need to focus on breast cancer, but I need to assure that every member who enters our breast center has maximal protection from COVID-19. Things have indeed changed. Even with these changes, our commitment to improving the care and outcome of women with breast cancer has never been stronger, especially for those facing health disparities. Breast screenings were halted in March, but they're returning. Elective surgeries were canceled, including surgery for women with newly diagnosed breast cancers. But now things are reopening. Operating rooms have reopened for patients, some of whom have already waited weeks or months. These circumstances require you to do three main things to maximize your breast care during COVID. First, take self-breast exam seriously. Until breast centers fully reopen, it's critical. No one knows you as well as you do. Second, know your risk factors so that when you do have your annual screening, you can be knowledgeable about what you need for optimal screening. Please do not skip this year's screening, as we know the difficult fact that some women will have a larger cancer diagnosed by the delay. It's the best we can do in these unprecedented times. And third, monitor the status of breast screening in your state so you know when you can go back. As a physician, I can tell you that my colleagues and I have had to make harrowing decisions that we never thought we'd have to face in the United States. We had to decide whether a high-risk woman can get screened, whether a woman who is newly diagnosed with breast cancer must wait for surgery, and whether someone's symptoms are sufficiently significant to warrant a diagnostic test that necessitates leaving the safety of your home. Now, I'm happy to report that breast centers are reopening in phases. The ones that are reopening, like ours, are implementing the most stringent safety measures so that when women do return for their screening, they will be safe. These measures include daily screening for COVID of all staff and patients, social distancing by reducing the number of patients in the office at any time, necessary cleaning between every patient, and strategies to minimize the time and number of people in the facility at once. I urge you to check your state status to know when it is safe for you to be screened now. For symptomatic women, care never stopped. Physicians never stopped seeing women with breast problems. If you have a problem, reach out to your healthcare provider. Get the imaging and care you need. It's available to you now and has been throughout the pandemic. This is all new to us, as it is to you, but the commitment to early detection is no less. So how are COVID and breast cancer similar? They both require us to harness the fears associated with disease for the better. With COVID, do all you can to avoid the disease. Stay home as much as possible. Wear masks when you are out. Wash your hands and maintain social distancing. With breast cancer, be diligent about breast self-exam. And as we move forward, insist on risk-based screening with annual mammograms. For women with dense breast, insist on annual screening ultrasound. And in those at greater risk, MRI may be needed. We are committed to maintaining the extraordinary gains we have achieved with a 40% decrease in the death rate from breast cancer over the past 2 decades. Please do all that you can to prevent both breast cancer and COVID-19. And please do not skip your screening this year. Now, I'm delighted to welcome back Andrea Wolf and thrilled to introduce my friend, Valerie Jarrett. Valerie B. Jarrett is a Senior Distinguished Fellow at the University of Chicago Law School and a Senior Advisor to the Obama Foundation and ATTN. She serves as Chairman of the Board of When We All Vote and co-chair of the United States of Women. She also serves on the boards of Ariel Investments, 2U, Lyft, the Innocence Project, the Economic Club of Chicago, and the John F. Kennedy Center for the Performing Arts. Her New York Times best-selling memoir, Finding My Voice, My Journey to the West Wing and the Path Forward, was published in 2019. Valerie Jarrett was the longest-serving senior advisor to President Barack Obama. She oversaw the offices of public engagement and intergovernmental affairs and chaired the White House Council on Women and Girls. Valerie Jarrett has a background in both the public and private sectors. She served as the Chief Executive Officer of the Habitat Company in Chicago, Chairman of the Chicago Transit Board, Commissioner of Planning and Development, and Deputy Chief of Staff for Chicago Mayor Richard M. Daley. She also served as the director of numerous corporate and not-for-profit boards, including Chairman and Chief Executive Officer of the Chicago Stock Exchange, Chairman of the University of Chicago Medical Center Board of Trustees, and Director of the Federal Reserve Bank of Chicago. Valerie practiced law for 10 years in both the private and public sector and has also received numerous awards and honorary degrees, including Time's 100 Most Influential People, as well as the Abner J. Mikva Legal Legends Award. Valerie Jarrett received her BA from Stanford University in 1978 and her JD from the University of Michigan Law School in 1981. Valerie has helped navigate this country through many challenging times, and we are thrilled to have you here today. Thank you so much for being here.
Thank you so much. Thank you, Rachel. Hello, everyone. Hi, Andrea.
Hi, Valerie. Thank you so much for being here and for being such a staunch supporter and friend.
My pleasure.
So if I may, I'm going to start the discussion with Valerie and talk about your extraordinary commitment to healthcare in America and your contributions to the Affordable Care Act. These contributions have transformed how people in the United States access care, especially in communities that are often overlooked. Now that we are on the cusp of a new approach to healthcare, how do you think telemedicine will impact communities, particularly those experiencing health disparities, and will telemedicine result in improved access and improved healthcare?
Well, that's a good question, Rachel, and I suppose it depends. In some communities, it will make life easier. You'll avoid having to take public transportation to the doctor's office. You'll be able to access it more efficiently in a better organized manner, perhaps. I know just a few weeks ago, my grandson had a health issue and they were able to get right on the phone quickly with an allergist, and nobody had to take off of work. Nobody had to schlep them down to the doctor's office. It was very efficient. But we also know that there are many communities around our country that don't have access to Wi-Fi. This is suddenly becoming publicly known now, although certainly it's been known for a very long time, as children are trying to learn online. But if there isn't Wi-Fi in the home, then how are you going to be able to learn online? How are you going to be able to access telemedicine when there are so many parts of our country where these resources are not currently available? So I think we have to close the technology gap. And if we do that, then I think it will be a net benefit. I think it will make your life easier to the degree that you can have fewer patients coming into your offices. And I think for the patient's perspective, it'll be much more convenient. Obviously, we're still going to have inpatient visits where appropriate. But I think if we can close that technology gap, it will make life easier. And I would also add, and thank you for the kind words in the introduction about the Affordable Care Act, but one of the provisions of the Affordable Care Act that doesn't get sufficient attention, and I'm very happy with the ability to get preventive care without any copay, particularly for women's health care. But there were also resources put in there to research the health disparities that we know exist in many communities of color. And the COVID-19 virus has really laid bare just what a dramatic impact those health disparities can have on communities of color. And so I'm hoping moving forward that the monies that were available to study that important disparity are replenished in the federal budget, and that is then used as a tool to figure out how to close this disparity gap.
You know, to me, it's been fascinating. I think clearly we have to bridge that technology gap. But one of the most striking things about telemedicine about COVID and telemedicine is two things. we have been trying for a decade to really implement telemedicine, and we really haven't done a good job of it. And suddenly, as a result of necessity, it's exploded in a very positive way. The other thing that we've seen is that the no-show rate has plummeted. So people don't have to leave their work. People who would find it an enormous hardship to leave work, take public transportation, come to a doctor's office, take a whole day off, don't have to do that anymore. So I think the other thing is it's really blossomed in technology to be able to send to patients so they can do things at home that we previously had to do in the office. So thank you for that. Now I'm going to turn the discussion over to Andrea.
Hi, Valerie.
Hi, Andrea.
Thank you so much. So I'd love to chat with you a little bit about your nonprofit, When We All Vote. When We All Vote is instrumental in changing the culture around civic engagement and voting in America. Do you think digital or remote voting in the age of COVID is a realistic option? And if so, how do we do that as a country while still protecting people's privacy and preventing fraud?
I think it is realistic. The question is there the political will to implement it? Look, we've been calling through When We All Vote for increasing the capacity to vote by mail, making sure that the Postal Service has the resources it needs, encouraging states to have vote by mail and without any explanation, just you want to vote by mail. We've also been encouraging early vote to be expanded so that every state in the country gives folks the opportunity to show up other than during the weekday in the middle of the week where many people don't have the ability to take off of work. And we were arguing for that long before the COVID-19 pandemic. And we also think that you should be able to register to vote online. So are there ways in which technology could make it safe, fair, and accessible to vote online and to use technology as a tool? Absolutely. Do I think that in this climate that's going to happen before November? I don't. I think we should be moving in that direction. And in a sense, this pandemic has laid bare the reasons why it's so important to be able to have options and maximum flexibility in order for people to vote. Everyone saw those incredible lines out in Madison in Wisconsin during the primary, where people were choosing between exercising their right to vote and their health, and you shouldn't have to do that here in America. And I think part of what we are calling for at When We All Vote, which is, I should pause to say it is a nonpartisan, not-for-profit 501(c), as you mentioned, Andrea, designed to change the culture around voting, because we feel that part of our responsibility as citizens is to be engaged, to be an informed voter, find out who's running for office, and it isn't just who's running for president, although that is an important office. It matters, and this current climate of unrest as a result of police violence shows how important it is who the prosecutor is, who the mayor is, who appoints the police chief, who's the U.S. attorney in various areas of the country, who are the attorneys general in various areas of the country, who are the judges in various areas of the country. All of these elected offices affect our daily life. Who's on the school board, who's on the police review board. And so again, this year, 2020, that has been so devastating in so many ways, has helped people appreciate the appropriate role of good government at the federal, state, and local level. And what happens when we don't have that? We've been all getting the civics lesson, and there are many people in the country who probably didn't even know who their governor was. Well, now people are paying attention because they know that their life and their livelihood depend upon decisions that are made at the state level. So I wish I were more optimistic about whether or not the answer to your question would be yes, but it certainly could be a reality. We just have to have the will to do so.
So given where we are, just realistically, who is in elected office right now, what is going on in our country, both from a, cultural perspective and a health perspective, what would you see as a win here? Like what would you turn to the other folks at When We All Vote and say, this was successful, we really did this?
Well, let's look back at 2018. When We All Vote was organized and set up the summer before the midterm elections, and we did see a real uptick in turnout in those midterm elections. Young people, for example, we're focusing a lot of our energy on young people and people of color, people who have either disenfranchised themselves or have been systemically disenfranchised. by policies and practices.
Mhm.
And so for young people, normally in a midterm election, they vote about 20% of them vote. Well, in the midterms in 2018, it went up to 30%. That's a huge statistical jump.
Mhm.
But look, 70% still aren't voting. And so part of what When We All Vote does is partner with organizations around the country who for a very long time have been on the ground working on voter registration and voter turnout, sharing best practices about what works, all of which is much more challenging in this pandemic. We had a huge rally plan for former First Lady Michelle Obama back in March, obviously had to cancel it as a result of this pandemic. We're having to use virtual for everything and reach people where they are in new and creative ways. And you know, we have and continue to have plans with high schools to get people to register in that first election, because if you vote in your first election, the chances are you'll become a lifelong voter. Working with colleges and universities, over 600 are committed to working with us on this, but now they're all virtual too. Businesses that have stepped up to the plate to ensure that their workforces are registered and that they are helping support our efforts. So we have a whole range of partners working on this, but it is more challenging in this environment. And one of the concerns we have, which is why we kind of are supporting federal legislation that would require this vote by mail and the technology available to register online and expanding early vote, is because we want to be prepared for November. And so the foundation for that work has got to begin now. So if we can see a continued uptick in actual voter registration and turnout, that is a win, Andrea. And I have to point out that this is not just about one election or one candidate. All of the offices matter and all of the elections matter. It is really about changing the culture to get people to appreciate that if you want to be a part of a democracy, then you have to step up to your role as a citizen.
Yeah.
And the most fundamental responsibility is to vote. But I would argue vote plus be civically engaged. Everybody can do something to be a force for good in their communities. And realizing that and doing what's within your power is a big part of our mission as well.
I think that's right. I think, you know, we are fortunate in that we have had the luxury of being in a country that's so free for so long that we might take for granted that the opportunity to vote and the right to vote is a privilege, and that you know, when you really view something as a privilege, you don't brush it aside, you use it. So we got to get back there, and maybe unfortunately the crises that we're facing will be a bit of a kick in the butt for some people to get back out there. I hope that's a positive outgrowth of this. So
it should be a wake-up call about
I think so.
And you're right, Andrea, as you said, you can't sit passively by and abdicate your responsibility and expect that the leaders are going to keep your best interests at heart. You have to demand it of them, and you have to hold them accountable. Accountability is a really important factor here. So I think that voting is a way of holding them accountable. And then once they're elected, you still have to make sure that they feel you and that you keep the pressure on them to ensure they do the right thing by you.
I think your language is exactly right in that if you think of it as a responsibility, you don't shirk that, right? So if you think of being a parent as a responsibility, you don't not give your kid a meal. And if you think of a job that you have and you want to hold that job and do well at that job, you don't not fulfill the obligations of the job, right? In any form of responsibility, you don't just let it lay fallow. You have to exercise it so that you can do well. And I think this should be on that list as well. So I do appreciate so much what you're doing.
Thank you so much.
Speaking of appreciating what you're doing, I will shift gears only slightly and ask you a little bit about your role as a board member at Lyft. As you well know, Lyft was instrumental in helping the Brem Foundation create the country's first cost-free ride-sharing program that's exclusively dedicated to breast care. It's called Wheels for Women, and it has taken off in a way that we never even could have dreamed. Now that we're facing the COVID crisis, though, how do you see transportation for healthcare transforming in the future and continuing to allow people to access the healthcare that they need?
Well, first of all, I'm so proud of Lyft's decision to support the Brem Foundation and all the important work that you are doing. And I have to tell you, it was the easiest ask I've ever asked of anyone. The answer was immediate. Yes, of course, this is what we're here to do. And I joined the board because I really shared the values of the founders, and because of my background in transportation and urban planning,
Yep.
I realized how important it is to have safe and affordable transportation to complement the public transportation and other forms of transportation available in our communities where density is an issue, traffic is an issue, and everybody wants to just be able to spend more time with their families and get where they have to go safely. So it was an easy decision to join the board, but when they make decisions such as the one to support you, it just makes me so incredibly proud. In this current environment, Lyft is working with organizations such as the Urban League, ACLU, local elected officials to figure out ways of making available transportation for essential workers, as well as products that have to be delivered. So they are spending a lot of time and energy right now trying to make sure that they are providing this additional service, while at the same time keeping both the drivers and their riders safe. And so insisting that everybody wear masks, having protocols on the cleanliness of the cars, informing people about what our responsibilities are, that not just keep us safe, but to keep the people with whom we interact safe. And so I think that their record and their efforts on this are really good, but this is obviously challenging. Many of the riders saw a decline in their ridership when we were in the midst of this pandemic. We're hoping that that will grow as we go forward and people get back to work. Our economy obviously has suffered a real tough blow, and everybody suffers as a result of that, including companies such as Lyft. But the fact that they are electing to do the right thing and to be responsible corporate citizens gives me a great deal of satisfaction to serve on the board.
Yeah, I mean, we have already gotten requests for more rides even before DC hasn't even done phase 1 of opening. And, you know, there are people in need who are still wanting those rides. So I have every confidence that that program will expand, especially as, unfortunately, healthcare needs expand.
As people lose their jobs, lose their healthcare coverage, have less resources to access healthcare, the ACA takes care of screening, but this will fill a need. And I also think it speaks to your civic engagement importance, which is that now we've started it in Washington, D.C., and Lyft's commitment to civic responsibility is trying to expand it in many cities around the country because it has become so successful. So thank you for that.
Oh, of course. It's terrific.
By way of follow-up, do you think driverless cars and investment in R&D there is going to be part of the answer so that there's less exposure to other people?
Well, less exposure and giving people access who otherwise would not have it. I mean, I think of my 91-year-old mother who still drives. I sure wish she wouldn't.
Right.
And I've now gotten her to the point where before the pandemic, where she was beginning to use Lyft on a more regular basis. And we live in a part of Chicago where it's really hard to get a taxi cab.
Yeah.
And so having that reliable, fast and available transportation at a price that's affordable is important for senior citizens, for people with disabilities, for a whole range of folks who otherwise would be left without a viable means of getting around. So I think for a whole host of reasons, it's beneficial.
Yes, thank you. I think I'm hopeful that that's what will be on the road soon too.
Yeah, absolutely.
So this is a bit of a tough question, but one that I am fascinated by. What do you think will be our next president's biggest challenge? And if you were his advisor, how would you guide him?
Well, I think the challenge, of course, will be as we emerge from this pandemic and from this crisis and confidence in our justice system, what do we do to rebuild trust? What do we do to bring our country together, to galvanize the energies of the American people, to look out for one another as we strengthen the economy coming back, and that we're building the kind of safety nets into our initiatives to make sure that we don't just simply go back to where we were before the COVID-19 and before the most recent demonstrations over police violence, but we actually move forward and we build a better, safer, more just, more accountable country, that our lives and our livelihood are protected in a way that we really weren't in this current climate. And so it's a tough task. It's going to be a tall order, I know. And I think that obviously I have a very clear choice in this matter. And I think it's not really, though, about one person. It's about surrounding yourself with people of goodwill who want to be public servants. I started my career in local government. I'm a huge believer in local government service. You're Your folks that you serve are right there. You see them in the grocery store, the dry cleaners, the park. They have your phone number. They know where you live. It's 24/7, and that's how as it should be. And so I'm looking forward to having a president and a cabinet and a Congress that, even though they are removed from the people they serve, understand and appreciate and keep those stories and priorities front and center.
That makes a lot of sense. What is the shining moment of your career and why?
Well, you know what? I'm now pretty old and have had a long career. So there have been many moments of which I am proud. I suppose realizing the millions of Americans that the Affordable Care Act affects, its passage means a great deal to me. And I'll tell you a quick story about the night it passed. I had gone home to watch the vote. It had been such a Herculean task for reasons I don't understand. Why was it so controversial to make sure that Americans with pre-existing conditions wouldn't be discriminated against by their insurance companies, women having access to preventive care, not worrying about annual or lifetime caps so that your insurance would run out when you needed it most. Young people like my daughter, who when she was under 26 could be on my health insurance plan, senior citizens getting a break on prescription drugs. All of the benefits of the Affordable Care Act were so important, yet it was so hard to get it passed. But the night it was scheduled to pass, I went home to watch the vote. And President Obama's assistant said to me, President Obama wants everybody who wanted to everyone who worked on the Affordable Care Act to come back and watch the vote at the White House. And so I thought, oh, I'm home, I'm settled. And she's like, no, maybe you didn't hear me. President Obama would like everybody to come back to the White House. So we schlepped back to the White House and watched the vote. And it was just such a feeling of exuberance. So late that night, President Obama had invited everybody up to the Truman balcony who worked on the legislation, from the vice president to the junior most person on my staff, all there to celebrate together. And he went around and he thanked everybody. And I asked him at the end of the evening, Andrea, how do you feel tonight compared to election night, where there's also this exuberance of the unexpected, the unlikely candidate to win, and we were all out in Grant Park in Chicago in an unseasonably warm evening, and it was warm that night out on the Truman balcony. And he said, there's no comparison. Election night was really all about getting to this night, where we used the election to do something so important for the American people. And I think about the states who've expanded Medicaid. And so many of the folks who are in the group that you were trying so hard to help have insurance that they wouldn't have had but for that expansion. The exchanges that give people the opportunity to leave a job with insurance and start their own business because they can get affordable health insurance. So all of the benefits that inure to the benefit of the American people come through that. And I'm not saying it's perfect. There's still pockets in our country where health insurance is too expensive with private insurers, which is why I support having a public option. I think it would help competition, bring prices down, and be a lower cost option for Americans who don't have an option in the private market. But it's so much better than it was. And so for that, I'm pretty proud.
Thank you. And I am personally, obviously, committed to making sure that those communities who don't normally access healthcare the way we wish they would get that care. And I'm doing it in small part in partnership with you. And I feel very lucky to be doing that with somebody who has had such an outsized impact on healthcare in the country. It's a big deal. No, it's really a big deal. And I appreciate it very much.
Well, I appreciate you and your mom and everything that the Brem Center does, because there was a whole group of women, African-American women, who have high risks, who were not getting the preventive care that they needed, let alone the treatment. And you are making that possible.
And as someone who sees the impact of it on an individual basis, it's just been critical. I mean, the idea of being able to go in, no copay, no deductible for screening examinations is the critical component of truly making it available. And, in terms of risk, the American College of Radiology, in its last iteration, put all African American women at increased risk because of the markedly different death rate. So, I think helping that population has been a critical component in bringing down the death rate from breast cancer. So thank you.
Thank you both for that.
Valerie, that's all I have for now, but we have a lot of questions from the audience of people who want to know all sorts of things about you and from you. So I would love to open it up if that's okay with you. The first two that popped up actually have to do with young people. So there's a lot of interest in encouraging young people to be more involved. The first question I'll ask is from someone who says, I'm a 13-year-old girl living in DC. My summer camps are all canceled, so I have a lot of time this summer. What can I do as a teen to help mobilize voters and other kinds of activism? Are there any programs specifically for teens who want to help?
Yes, absolutely. That's our high school program where we're working with high schools around the country to help register. Just because you're 13, there are a lot of folks in your high school who are eligible to vote, and we could use your help helping to organize and get them online. You can go on whenweallvote.org, sign up as a volunteer. There is no age too young to be one of our volunteers. Form a voting squad with your friends who are older and eligible to vote, your family members who are older and eligible to vote. Your voice is such an important voice. You can make a huge impact. And so take advantage of this summer where what you would normally be doing isn't feasible, to use that telephone and the internet to your to help really educate people about issues you care about. I mean, one of the ways that I think is impactful in getting people to vote is to ask the person you're trying to convince to vote, well, what do you care about? I was talking on the phone yesterday with some of the young folks from Parkland who now have gone on and graduated in college, started March for Our Lives, the organization that's dedicated to ending gun violence. They care passionately about that issue. And that's what got them involved in voter registration. And so one by one, ask people, what do you care about? And then say, well, who's the candidate that cares about that issue? And what's their platform? And why do you think that they're going to actually move your agenda forward? And what our research shows is that with young people, they're so issue-oriented as opposed to party-oriented. It doesn't say just vote the Democratic Party. That doesn't work for them. They have to say, who's going to look after preserving our healthcare? Who cares about climate change? Who cares about making sure that the United States is doing right by our allies around the world? They care about those kinds of, who wants to reduce gun violence, end police violence, build communities of trust, build a better education system, more affordable college, more affordable childcare, workplace policies that protect us from equal pay to paid leave and paid sick days, and strengthening the back of the Affordable Care Act. And if you start getting the people to talk about those issues, they can see the nexus between those issues and the impact of their vote.
Thank you. So if you see somebody named Josie Silverberg sign up for volunteering with you, that's the rock star that just asked that question.
I will.
We have another question from a young person. I'm a 21-year-old university student who's concerned about returning to school in the fall. The university I attend has not indicated to students yet whether or not they are looking at alternative options apart from personal research. What other suggestions would you make for advocating for student safety for the fall and subsequent semesters when it comes to COVID?
Well, I think the good news is that the college and university presidents with whom I've been in contact are taking this responsibility pretty seriously as a whole. Not all of them. Some of them are welcoming people back without really thinking through the consequences, but the vast majority of them are following the science. And this is one where I think we all have a voice to encourage our academic institutions, whether they are public schools, private schools, colleges and universities, to follow the science, do what the CDC tells us to do. Their guidance is well steeped in evidence-based practices, and to take those protocols seriously. And we can all lift up our voices to put pressure on them to do just that.
Thank you. We have another question. Valerie, if you were in the White House now, how would you advise our president in dealing with the coronavirus, especially given your time in the White House during the Ebola outbreak, which was successfully curtailed?
Yeah, so we learned a lot during Ebola, H1N1, Zika, that prepared us to do what we did during our time in office for what we knew would be a global pandemic. And in fact, back in 2014, President Obama gave a speech and he said within 5 years, we should expect, the science tells us we should expect a global pandemic. And he was right on the money in terms of the timing. as a result of the experiences that we had with Ebola, Zika, H1N1, we set up in the White House an office in the National Security Council devoted to global pandemic health. We set up offices around the world in the CDC so that people would be, our researchers and scientists would be on the ground in countries to have an early alert system so that if a pandemic did break out, we'd know about it right away. We prepared a tabletop exercise for the administration that came in to walk through what would you do in the event of a pandemic, to give them the experience of practicing and getting prepared. And we prepared a 69-page report, which we delivered during the transition as well, so that they'd have kind of a guidebook of what best practices are that we learned. None of that happened. And so my advice would have been back in January or maybe even December, we're still trying to figure out when we have these first cases, is to pull out that report. They eliminated the office in the White House that was devoted to this. They defunded the CDC. They zeroed out our budget request to put additional resources to prepare for a pandemic. So the stockpiles began to deplete over the last 3.5 years. And in the beginning, there was a sense of denial, followed by happy talk. And I don't know, Rachel, I don't know as a physician how you handle it when someone in a position of power says, well, maybe we should use hydrochloroquine untested, or maybe we should inject Lysol or light, and that we just, the kind of the willful carelessness with which ideas have popped out, I think have been very stabilizing. Not wearing masks in the White House. I know our President Obama leads by example, and so he would have wanted the scientists to come in immediately, tell us what they know, be honest and direct with the American people. And you know, when people tell you the truth, you can tolerate all kinds of bad news. You know, I remember back in February, I said to someone, well, what if we just shut down for 3 weeks? Everything. Just shut it all down other than essential workers. And people thought that was like the nuttiest idea in the world. Well, you know what? Now it's been 3 months. And wouldn't it have been better just to tell us, let's just do this and do it right and follow the science? And so I suppose the short answer is, when you're dealing with a pandemic, an infectious disease, you should listen to the scientists. And if you take care of the science, the economy will come back. If you are neglectful on the science, then you end up with a cascading health crisis and economic crisis.
We can see the impact of the science with the decreasing rates. It's been very impactful. You know, one of the difficulties of the past few days is what the impact will be on COVID as well. But we have such great science in this country, around the world. We need to harness that to the benefit of
Absolutely.
Thank you both. The next question is actually for Rachel. You said that we should not skip our screenings this year. How are you ensuring that patients are going to be safe from the COVID virus when they come for their annual screening?
That's a great question. The safety of our patients and our staff is paramount. And when we didn't have the ability to protect them, we asked you to please stay home. We have learned a great deal. Recently, in this past week, the data came out that double masking, meaning I wear a mask and you wear a mask, a surgical mask or a face covering of any kind, that it is virtually a 0% transmission. So we have learned a great deal. We have learned about cleaning. We've learned about screening patients for COVID. So we are doing all of that. What you will see is that we will not return to the way we were before. We will not have waiting rooms full of people. We will not have the same number of people, but we will be able to screen because it is critical. So that's how we are assuring everything we can to make sure that people are safe, and the data is supporting that, the science is supporting that, and with time we continue to learn and pivot. And I just want to say that just because things are changing doesn't mean we don't know. It means that we learn more and we implement the things that we learn. So we are doing everything we can. I have to say, I feel very safe at work. I did not feel very safe my first day back. We had a lot more unknowns, but I feel very safe, and I feel that our patients and our staff are very safe. We have contact tracing now. We have implemented an enormous number of systems that will keep our patients safe.
Thank you. Valerie, we have another question for you. And
Okay.
frankly, I don't mind that somebody asked this. You have always been profoundly committed to women's health. If you were on the Brem Foundation board, how would you advise them now?
I would advise them to just keep doing what you're doing. I would be out there helping them raise money as we are today, recognizing that the resources that you raise translate into helping human lives. So I wanted to make time for this event today because I so support the work that you're doing. I support the passion and professionalism and commitment that you have. Your mission is mighty and it's important, and there was a huge hole in Washington that you guys filled, that only inures to the benefit of women of color, poor women who but for you, would be without these resources. So I'd be a pretty busy board member helping you raise money to make sure you can touch as many possible folks as you could.
Thank you. Thank you, Valerie. In the interest of time, I'm going to ask one more question and then let people keep doing the good work that they are doing. Valerie, what is most effective at getting young people to vote?
You have to meet them where they are. You have to be authentic. You have to make them feel motivated that the issues that they care most about will be improved by the people who are running for office. And you have to help them be pragmatic to realize that not every issue, let's say you care about 10 things, maybe the candidates only embrace 8 of those things. That's a win. Good is better than nothing. Don't let perfect be the enemy of the good. I think sometimes young people sweetly are very idealistic and they think that people should be perfect, but we adults are flawed, and so you have to go for whoever is the best that you can get and take the time to do the homework. So making it relevant to them, meeting them where they are. Peer pressure is very helpful, much more helpful than me calling them up saying you should vote, is when their best friend goes, hey, let's go and do this together. Making it relevant to their lives, I suppose, is the most important.
Thank you very much, Valerie. Thank you. I can't thank you enough. As you know, we are simpatico, and I am so grateful for the work that you're doing, and I appreciate so much what you said about the work that we're doing. I also want to thank the over 300 people who registered for today's event, and thank you to Dr. Rachel Brem for sharing your important perspectives. We hope everyone here will get their breast care and encourage their loved ones to do the same. Please also take a moment to contribute to the Brem COVID Emergency Fund. Every dollar for us is so critical right now. I can't stress that enough, and I mean it from the bottom of my heart. Also, stay tuned for more exciting programming from the Brem Foundation. Wishing you all a safe and wonderful summer, and thank you so much for your support. Have a wonderful
Bye-bye, everybody.
Bye.
Thank you. Thank you all for what you're doing.
Thank you, Valerie.